Kia ora koutou katoa. It's a real pleasure to be here with you today at the InterSystems Virtual Summit, and what a year 2020 has been. My name is Dr. Lloyd McCann. I'm the CEO of Mercy Radiology and Clinics and Head of Digital Health for Healthcare Holdings Limited. I'll tell you a little bit more about those organisations in a few minutes. We're here today to talk about the year that has been 2020 and this little thing called COVID-19 and how that has become a catalyst for innovation for us here in New Zealand and within our context at Healthcare Holdings Limited. A brief outline of what we'll cover today. I'm going to be describing some of the context we find ourselves in here today in New Zealand, both within the health system and importantly within our own context at Mercy Ascot hospitals. We're going to be covering COVID-19 and what that has meant for New Zealand and us as a health system, and some of the responses both our system and our individual organisations have taken to address the challenges that COVID-19 have presented. Very importantly though, we're actually going to be examining the opportunities COVID-19 has brought and how we've harnessed those opportunities to drive better patient care along with our technology partners. We're also going to be talking about something that's changed for us this year, a virtual go-live of one of our core systems, our EMR, and how our partner InterSystems enabled us to make sure that went really well. Going to be exploring some uses of healthy data and how that has enabled Mercy Ascot and Healthcare Holdings Limited to become a data-driven organisation. And finally, some lessons learned and some reflections around everything that has been the year 2020. So, to get us started, New Zealand's health and disability system has been described as a complex network of organisations and people. In a few minutes, I'll show you a diagram of that system to demonstrate just how complex it actually is. New Zealand's health system is predominantly publicly funded, although there are elements that have a user pays aspect and also a privately funded aspect. One of the things in play for New Zealand over the last 2 years has been a review of the health and disability system. And I was privileged to be part of a ministerially appointed expert panel that looked at the entirety of New Zealand's health and disability system. And what we found was that on the whole, New Zealand's health system does deliver excellent outcomes for the patients it serves. Of course, it's not perfect, and there are a number of areas for improvement, and I'll talk through some of those a little bit later on. Just about our local context then. Healthcare Holdings Limited is New Zealand's largest integrated provider of private health services. And I'll describe why we are an integrated private healthcare provider, again a little bit later on in the presentation. This is a diagrammatic attempt to describe New Zealand's health and disability system. So as you can see from this diagram, it is indeed a complex network of organisations and people delivering health services to New Zealanders. What this aims to show are some of the accountabilities and funding mechanisms that are in play in the system. And again, the takeaway from this is that the system is indeed incredibly complicated. One of the findings from the New Zealand Health and Disability System Review was that it is too complicated for a patient to actually navigate. And the system needs to take more ownership of actually driving patients through this system and getting those services they actually need. Some key entities within the Healthcare Holdings Limited umbrella include Mercy Ascot Hospitals. So we are a large tertiary provider of healthcare services, predominantly elective surgery in the Auckland region. We operate across 3 different hospital sites, where we run 22 theatres and have around 220 inpatient beds. We see around 15 to 20,000 patients come through our doors every year, and we offer everything from simple surgery in the general surgery space, such as hernia repairs, right up to more complex surgeries such as neurosurgery, cardiothoracic surgery, and complex head and neck surgery. We also have Mercy Radiology within the Healthcare Holdings Limited family. So we run 16 branches across the greater Auckland region and again offer a range of diagnostic services from basic diagnostics like X-ray right through to PET-CT, etc. We also have Auckland Radiation Oncology as part of the group, And the reason I mention this is our Epsom campus is the country's only integrated, comprehensive cancer care centre in private. So within this space, we're able to offer everything that a cancer patient might need, right from the diagnostic end of the patient journey, right through treatment and rehabilitation, including things like medical oncology and radiation oncology. Just a few comments about healthcare in private. So although we are predominantly a publicly funded health service or health system across New Zealand, we do quite a bit of work in the private component of the sector. So across New Zealand, we do around 350,000 elective surgical procedures in a year. Around half of those are done in the private component of the sector. If we look at emergency care, so New Zealand emergency departments would see around 1.2 million patients in a year. A private provider of urgent and emergency care, White Cross, sees around 400,000 patients in a year. And of course, all of our general practitioners or primary care practitioners are actually private providers themselves. So again, going back to that initial diagram, you can see that there is a number of hybrid models that are in play in New Zealand's health and disability system, and that it is indeed quite complicated. A number of drivers have been in play that have forced New Zealand's health system and ourselves at Mercy Ascot and HHL to actually think about transformation and how our services need to change to become more consumer-centered. One of the key drivers of this is something called value-based care that I'm sure many of you are familiar with. So this is where we define value in healthcare as the outcome we're able to deliver for our patients divided by the cost of that care for that patient episode. A number of other drivers have also, of course, been in play. People expect more from the health services they consume. So that notion of consumerism has really entered the healthcare market, and it's important now that we actually deliver outcomes to patients that matter to them. Of course, there's the aging population and the increasing chronic disease burden, and a number of other drivers, including digital disruption, that have forced the health system to take a good look at itself and to start transforming over the past few years. I mentioned the New Zealand Health and Disability System Review, so to come back to this and specifically look at digital health for a few minutes. We have underinvested in digital in New Zealand for a number of years. That is very critically one of the findings of the Health and Disability System Review. So we will see a lift in the investment in digital capability over the next few years within New Zealand's health system. Importantly, however, we've also noted that digital health approaches is a critical enabler to the delivery of services moving forward. So digital health is not going away, and in fact, before the arrival of COVID-19, a number of things were already in play that forced the system to adopt more digitally enabled approaches to delivering healthcare. So, 2020, and along came this thing called COVID-19. New Zealand's response to COVID-19 has been earmarked or has been noted to be one of the world's best responses to managing the pandemic. So our first case occurred towards the end of February 2020, and what we saw our key decision makers move to was to enact a plan that rapidly dealt with this emerging threat. So New Zealand closed its borders in late March, and soon thereafter, the country devised an alert level system that would guide the population and obviously our decision makers in terms of the management of COVID-19. In late March, we entered one of the most severe lockdowns generated across the world as a response to COVID-19. So to give you some examples of the restrictions that were put in play, there was basically no public commerce that was able to take place. Most organizations had to shut their doors unless they were considered an essential service. So these were healthcare services, some postal services, supermarkets obviously so that people could purchase food, and petrol stations as an example so that people who needed to travel were still able to access fuel. That alert level 4, as we termed it, was put in place to break the train of transmission of COVID-19. And what became apparent very quickly was that given New Zealand's geographic location in the world, we could look to undertake an elimination strategy. So although it was very difficult, that mantra of go early and go hard really served New Zealand's population very well. So in those early weeks, we did see a steep increase in the number of cases, but in comparison to other international jurisdictions, our case numbers amounted to cases within the hundreds as opposed to the thousands. We also managed to control the mortality associated with COVID-19. And so here again today, we are one of the nations with the lowest death rate due to the pandemic. What we saw in terms of some digital responses to COVID-19 across the health system was rapid adoption of technology. So most healthcare providers needed to pivot very quickly and move to offer telehealth as the core service delivery model. So all of our general practitioners had to offer telehealth consultations because what we knew again from international experience was that waiting rooms for healthcare services was a very critical breeding ground for COVID-19. It took us a little bit of time to get our heads around this, but our approach to contact tracing is now also digitally enabled through a contact tracing app. And people have adopted and started utilizing this application now, which is helping to drive the ongoing management of the pandemic within New Zealand. Importantly, however, there was a return to some basics. So what we saw, despite all of our technological advancement, was that simple things like hand hygiene, physical distancing, the appropriate use of personal protective equipment were key tools in the fight against COVID-19. The interesting thing about our health system through this period as well was that people had a huge appetite and willingness to engage in that change process. So whereas it might have been more difficult to adopt digital technologies pre-COVID-19, people's appetite and desire to get on and do the job with the technology had certainly increased. In terms of our local context, so Healthcare Holdings Limited, we've already been on a journey of digital transformation. We see digital health as a critical enabler for value-based healthcare. We've had some really great achievements in terms of that value-based healthcare space. As one example, we've transformed a head and neck pathway where somebody has a neck lump, they go and see their GP, get referred to a head and neck specialist, come in and have an F&A gets sent off to a pathology service. 8 to 12 weeks later in our most populous city, Auckland, that person gets a diagnosis and a treatment plan. Again, we asked ourselves the question, just how consumer-centered is a pathway like that, where a patient is needing to manage anxiety of what often ends up being a life-changing diagnosis for nearly 3 months. Through some innovative work, we've turned that pathway into one 45-minute appointment that is now enabled by technology, where a patient can come in, see all the relevant specialists they need, get all access to all the health services they need, and leave that 45-minute appointment with a diagnosis and a treatment plan. As I mentioned, our digital enablement journey has been going for a number of years. So we're the first provider in New Zealand to offer things like online bookings. We're utilizing robotic process automation to make our processes and systems more efficient. So this is a benefit for our patients and a benefit for our staff. We've also deployed a number of artificial intelligence algorithms to enable our clinical decision makers to focus on delivering care at the bedside. Foundational to all of this then is our patient administration system and our electronic medical record. So in terms of the Mercy Ascot context, we are definitely behind where we want to be in terms of PAS and EMR until we began our engagement with our excellent partner InterSystems. So we view PAS and EMR as a foundational enabler to delivering excellent health and digital health. We've predominantly been a paper-based hospital system until we've deployed our PAS EMR, and that has held us back. And I'll talk a little bit more about how actually being in that paradigm doesn't enable data-driven decision-making through the use of healthy data. Our clinical context, as I said, is one where we have visiting medical specialists. So we don't employ the doctors, the physicians, the surgeons that work within our facilities. We partner with them to deliver care. And obviously that has implications in terms of how we manage change processes, like the deployment of a PAS EMR. Again, pre-COVID-19, this has turned into a burning platform for the organization. We've not been able to truly deliver on these digital health approaches without having a modern and consumer-centered as well as clinician-friendly PAS EMR in play. So we knew we needed to address this and went through a process to identify InterSystems and the TrackCare product as the PAS EMR that would enable our systems moving forward. A few firsts have occurred obviously within this space for us as well. So within the New Zealand digital health landscape, we generally have always gone for a best of breed approach to delivering virtual health or digital health. Within the Mercy Ascot context, however, we are the first integrated PAS EMR solution in the country that has actually been deployed in the cloud. So a few challenges obviously needed to be worked through in terms of getting to where we've got to around our PAS EMR. What COVID-19 did was create a crucible environment for us. We had been working with our partner InterSystems and other partners in terms of our PAS EMR for a number of months. And of course, right at the time we were gearing up to go live, COVID-19 changed a number of things for the organization, which forced us to look at a virtual go live. So when I say virtual, I'm talking about a remotely supported go live of a significant application for the organization. I've been through some other EMR deployments in my career in health. One of the key tenets of any deployment, as many of you will know, is that you need the support of your vendor partner on the ground to provide that at-the-elbow support for your clinicians and for your clinical teams to ensure that that go-live runs smoothly. Given the restrictions around travel for managing COVID-19, we did not have what I've now come to learn is actually the luxury of having our vendor partner on the ground to support our go live. So we had a choice to make. We either wait, we ride it out, wait for COVID-19 to disappear globally, because obviously we needed people to come into our context from overseas, or find a different way to go live. And after some careful consideration, we decided that the latter option was something we needed to aggressively explore and implement. Because what we started seeing was skills fade and knowledge fade in terms of all the training we had undertaken to enable our staff to be comfortable utilizing TrackCare in the go live. So we got to a point where the benefits of waiting were certainly outweighed by the risks of waiting. So we needed to find a way to go live. What this meant was reliance on technology. So we utilized tools like Microsoft Teams, we utilized tools like ticket trackers, we utilized tools like Trust to enable this virtual go live. And I'll come back to some of those key lessons learned a little bit later on in the presentation. In essence, we needed to take a leap of faith to enable this virtual go live. And we relied heavily on the remote support of our partner InterSystems to ensure that that go live went well. So teams were working around the clock to ensure that we were responsive and enabled our clinical teams to deliver what they needed to deliver safely for our patients. So a whole new paradigm was in essence created out of the crucible that was COVID-19 to enable Mercy Ascot to go live and deliver the care that was needed for our patients. What that also showed us was that the use of data to drive decision making was critically important for the organization. And this is obviously one of the key reasons and tenets driving our digital strategy to ensure that we actually derive benefit from our digital transformation. So here is a representation of a simple learning loop. And one thing we know we are not that good at doing in healthcare is actually turning our data into useful information, but more importantly, intelligence and insights that actually drives our decision making. So for us as an organization, this was about shifting from working on gut feeling what do I think, to shifting the question to what do we know, now what do we think? And again, without that foundational EMR in place, we're not actually able to deliver on the promise of data-driven decision-making. And so for us, we view this across 3 horizons. Again, as I said, we need that EMR in place as a foundational element to drive our digital strategy and to drive our digital transformation. Horizon 2 for us is being a mature analytics organization. So that's around driving value for our consumers, for our patients, but also driving value for the organization in terms of understanding our processes and understanding where we can make improvements around those processes. So a real life example over here. Since we've gone live with Track Care, we are now able to track consumable utilization in real time. What this has meant for the organization is a significant lift in terms of our revenue profile, because we're able to see the consumables we're actually utilizing through the delivery of care, as opposed to the paper-based system we used to run utilizing our own pairs. So I'm talking about real dollar value benefits to the organization in terms of process optimization and revenue recognition. We do, however, want to shift from that descriptive base, which we've now got to actually utilizing predictive and eventually prescriptive analytics. And again, without actually digitizing the patient journey, we're not able to do that. Horizon 3 is the innovation horizon. Of course, COVID-19 has been a catalyst for some of that innovation, but again, the EMR is foundational in terms of allowing us to actually continue to automate, to utilize things like AI, and to embed the culture of change across the organization. So all of this comes down to a bionic approach. And what do I mean by bionic? This is about blending the best of human with the best of technology. An important part of that, obviously, for us, is selecting the right partners, the right technology partners, to actually enable us to deliver on this bionic approach. In this instance, that foundational component around the EMR is something that would not have been possible without the help of InterSystems and their team. So, we've obviously still got a way to go within New Zealand and within the HHL context. And some of the critical things we have learned is that you actually have to invest in the digital health space to derive the benefits and the positive impacts for our consumers, for our patients, and for our clinicians and non-clinical teams. So what we're seeing is a real appetite to invest and get in behind digital health across the system within New Zealand, because we've seen how critical enabler this actually is for the delivery of care and for improving patient outcomes. And so, a few reflections around this bionic learning journey that COVID-19 has really enabled through 2020. We've come to see that there is no one magic bullet or no one-size-fits-all approach to problem solving. We've also seen that old habits actually die hard. So despite a willingness and an appetite for clinicians to engage in digital health approaches like telehealth, we've seen some people actually revert back to more traditional models of service delivery. I think with the rising advent of consumerism and increased patient expectation, we will see that shift. And so certainly providers are still continuing to embrace digital health, but we also see that some of those old habits and old ways of working are actually very difficult to break. That bionic approach is critical. We've got to leverage the best of our humans and the best of technology. And what we've come to learn again through the virtual go-live experience is one example, is that the factors for success are mostly driven by human teams. So what am I talking about over there? We've come to learn that seeing change as a change management process is not enough. We've actually got to build and embed a change culture across the health system and across the organization. And only when people are actually comfortable that change is part of the new normal do we start to derive the true benefits and value of these digital health approaches. Partnership is critical, and this is a change for us. Traditionally, we've always seen our technology partners in a customer sort of vendor relationship. What the crucible of COVID-19 showed us was that we had to work in partnership with InterSystems to ensure that we got the benefits we needed to see through that virtual go live. So gone are the days of, almost in some instances an adversarial relationship. If we're not true partners in this, we're going to fail. And so our hats off and our huge thanks to InterSystems, who actually really came to the table to deliver as our partner in that virtual go live. We've always got to be thinking about the art of the possible. Go back not even 9 months. Considering a virtual go live for a hospital with the complexity that Mercy Ascot brings would not even have been on the radar. COVID-19 obviously brought it onto the radar for us and made it the preferred option. So always keep an open mind about what actually is possible. And what we saw again on both sides, Mercy Ascot and InterSystems, was that our teams really stepped up to the mark and made sure they worked to deliver safe care utilizing the technology we had chosen to deploy. EMR is foundational. So I talked about those 3 horizons of being a data-driven organization. We've come to learn that unless we have that foundational component in place, there's no point in even thinking about Horizon 2 or Horizon 3. And we're on that journey now and already seeing the benefits of that foundational enabler being in place. Most importantly, I think we've learned that all of the challenges and problems we face as an organization, and more generally, if I think about the New Zealand Health and Disability System review, is that those problems are complicated or complex or actually quite paradoxical. There's no such thing as a simple problem in health, to sum it up. And so in terms of our approach to solving those problems, it's got to be and. What do I mean by that? You can't think about solutions as a simple solution any longer. You've got to be deploying and testing multiple approaches and multiple solutions at one time to solve any of these paradoxes or complicated or complex problems. And that's a real leadership challenge. So for us here in New Zealand, we're certainly by no means completed our digital journey and our digital transformation. The country has come to see digital health as a critical enabler to delivering safe care for our patients. Yes, predominantly driven through COVID-19, but also due to a number of other factors. For us at Mercy Ascot and at HHL, digital health is a critical enabler to delivering on our value-based healthcare strategy. And again, a key lesson we've learned through the crucible of COVID-19 and over the course of 2020 has been that partnership is one of our key weapons and key approaches to ensuring we do deliver benefits for our patients and for our organisation. Again, it's been a pleasure being part of this virtual summit with you and with InterSystems. I look forward to learning some more from colleagues around the world. And again, we'd just like to express sincere thanks to our partner InterSystems for all of their valuable work in getting our healthcare organisation, our healthcare system to where it has got to, despite the challenges that 2020 has brought. Thank you.